Hi, I'm Pete McCall, the author of the recent ACE certified article on how to use the ACE integrated fitness training model to design high intensity interval training workout programs. I prepared a little presentation to show you how to apply the ACE IFT model to designing the HIIT workouts that will produce the results your clients and class participants want. On your screen, you see the ACE IFT model. The IFT model was created to classify exercise into specific categories and phases based on level of intensity. On your right, you see the three phases for muscular training: functional, movement, and load speed. But for this presentation, we're going to focus specifically on the left-hand side of the model. That's how to apply the three phases of cardiorespiratory training to designing HIIT workout programs. We have three phases are base, fitness, and performance. The three phases of cardiorespiratory training for the ACE IFT model are organized based on specific metabolic markers. You can see that right there on your screen. Zone 1 is the base phase of cardiorespiratory training. Zone 1 is that level of intensity below VT1, and I'll describe what VT1 is in a moment. Zone 2 is the fitness phase of cardiorespiratory training, and that's that level of intensity between VT1 and VT2. VT2, or the second ventilatory threshold, is otherwise known as the onset of blood lactate, or the lactate threshold. And the performance phase of cardiorespiratory training is that level of intensity above that level, the OBLA, or the lactate threshold. Now on this slide, you see the energy pathways associated with each phase of cardiorespiratory training. Below the first ventilatory threshold, that's VT1, muscles are using primarily aerobic lipolysis. Lipolysis is a breakdown of fat with oxygen to create ATP, or adenosine triphosphate. That's what muscle cells actually use to fuel contractions. Zone 2 is using primarily aerobic glycolysis. Glycolysis is a breakdown of glycogen into ATP. Zone 3 is anaerobic glycolysis, or stored ATP-PC. Muscle cells store a very finite amount of ATP available for rapid energy contraction. On your screen now, this is why ACE uses the talk test to identify VT1 and VT2. And I also put in here RPE, that's rating of perceived exertion. So on the left-hand side of the screen, on the vertical axis, that's the volume of oxygen consumed during exercise. And just so you know, the body burns about 5 calories of energy per liter of oxygen consumed. So the vertical part of the graph is volume of oxygen consumed per minute. The horizontal part of the graph is the exercise intensity. Below VT1, or below the first ventilatory threshold, the body is consuming primarily oxygen and using fat to fuel muscle contractions. Now, when exercise intensity starts increasing, muscle cells need energy quicker. So rather than using fat for fuel, muscle cells will start using stored carbohydrate, or glycogen, for fuel. When muscle cells start using glycogen for fuel, what happens is the lungs will have to expire more carbon dioxide. That's one of the reasons why breathing becomes quicker as we exercise. Well, actually, there are two reasons. Breathing becomes quicker because A, we need more oxygen coming into the body, and B, because we're trying to get rid of the CO2 because muscle cells are now using primarily carbohydrate for fuel. When it's not possible to talk comfortably during exercise, that means the working muscles have shifted using carbohydrate for fuel, so breathing becomes quicker to expire the CO2 and bring in more oxygen. That is the first ventilatory threshold. The second ventilatory threshold is the onset of blood lactate. That's acidosis. That's when muscles will start burning. What's happening is an accumulation of hydrogen ions. That can only be sustained for a very brief amount of time. And if you see on the screen, I put in the ratings of perceived exertion. Below VT1, it's about a 2 to 4 RPE. And remember, the P stands for perceived. Every individual is going to feel a little bit differently. But below VT1 is very comfortable. That's working aerobically. People should be able to do that all day long. At about VT1, exercise starts becoming a little more challenging. That would be about a 5 to 6 RPE. Work rate comes up, breathing becomes a little bit quicker, talking becomes a little more challenging. Between VT1 and approaching VT2, which is the onset of lactate, now talking is no longer possible. Your clients and class participants can talk a little bit, but they can only say single words or 1 or 2 words at a time. Now, working at an extremely high intensity above the second ventilatory threshold, There's not enough time. People are working so hard, they're exercising so hard, they're expiring carbon dioxide, they're trying to bring in as much oxygen as possible. They can only say grunts or maybe monosyllabic words. So that gives you an idea of how to measure intensity. If your clients can talk while they're exercising, they're working aerobically. If they can talk in single words or short phrases, they're working above the first ventilatory threshold. If they can't talk because they're exercising so hard, they're probably at or above VT2. Understanding that last slide explains how to use HIIT in the ACE IFT model. Zone 3, above onset of blood lactate or above VT2, should be only between 10 and 30 seconds in length. That's when your clients and class participants will be breathing really hard, working really hard, and what happens in zone 3 is a rapid accumulation of metabolic byproduct. That's where there needs to be recovery intervals during a HIIT workout. Zone 3 should only last between 10 and 30 seconds. Tabata training is a perfect example of that. Tabata work intervals are 20 seconds of work, followed by a brief 10 seconds of recovery. Zone 2 intervals can be between 20 and 60 seconds in length. Now in Zone 2, you don't want to coach people to go as hard as possible. Why? Because they cannot sustain a hard or extremely hard work effort for up to a minute in length. Zone 2 is meant for a longer work interval, but a little less intensity. And Zone 1 should be used for active recovery. So if you have clients and class participants working above VT2 in Zone 3, they can only sustain that for a brief period of time. There needs to be an active recovery interval in Zone 1 below the first ventilatory threshold. One way to think about that is clients may be extremely out of breath while they're working during that interval, and you want to allow them to have a little bit of an active recovery interval. As soon as their breathing comes back to normal, as soon as you hear them starting to talk a little bit amongst each other, then you know it's ready to get back to work. On this slide, I'm going to show you a little 30-minute HIIT workout using the ACE IFT model. One, keep in mind, you can use the talk test and RPE to gauge intensity. If clients can talk, they're working aerobically. If they can only say one or two words or no words at all, they can only grunt, it means they're probably working anaerobically. You can also coach them to go on a rating perceived exertion. 10 is the hardest they can work, and 4 is walking at a comfortable pace. They can decide the other points in between. Keep in mind, this is very important for HIIT workouts. The higher the intensity, the shorter the work interval. So if you are going to coach clients to work at a level 10, level 9 or 10, they're working in zone 3, you want to keep those work intervals to about 30 seconds or less. Anything longer than 30 seconds, fatigue starts accumulating rapidly, form and technique could break down, which increases the risk of injury. Zone 2 can be a little bit longer. Zone 2 can go up to maybe 60 seconds in length, but that's when you don't want to coach your clients to work at the hardest level possible. Zone 2, you might want to tell people, hey, I want you to be at an 8 out of 10, but I need you to hold that for 60 seconds. So you can see there on the screen, on the slide, there's a little 30-minute workout. Warm-up should be about 5 to 7 minutes. Get the body 100% warm. There should be a little bit of a sweat. Breathing should be quicker than normal. The first high-intensity work interval can be between 2 and 8 minutes in length. That's not for the entire interval. That's the first block of high-intensity intervals. You want work intervals between 30 and 40 seconds in length, and you want recovery intervals to be short. They can be between 10 to 30 seconds. Think of it this way. During a class, you want to have about a 2-to-1 work to recovery. So if you're having a client work for about 30 or 40 seconds, they need to recover for about 15 to 20 seconds. So you can have 2 to 8 minutes of 30 to 40 second length intervals in zone 2. Then you have a little active recovery period. What I like to do in class is we do one set. We'll do a set of high intensity exercise, somewhere up to about level 7 or 8 on RPE. We'll do that for up to about 7 or 8 minutes. Then we'll pull it back and I'll have them do core exercises. Plank, side plank, glute bridges, some kind of core exercise for about 4 to 5 minutes. That's active recovery. Then to finish the class, we do somewhere between 2 to 6 minutes of extremely high intensity exercise. Keep in mind, all the research indicates that when it comes to HIIT, less is more, meaning that doing just a little bit of high intensity exercise can produce great results. So for the final little phase of class, I like to keep it relatively short, between 2 to 6 minutes in lengths. The work intervals themselves are between 20 and 40 seconds long. The recovery intervals are very brief. This is usually where I like to use Tabata training. I know I referenced that earlier. Tabata is 20 seconds of work, followed by 10 seconds of recovery. The standard Tabata interval is 4 minutes in length. However, in a class like this, there's nothing wrong with doing 5 or 6 minutes of Tabata training, following that protocol. 20 seconds on, 10 seconds off. After that second really high intensity interval, it's time for a cool down, somewhere between 4 and 6 minutes. Let the body temperature come down, expire the extra CO2, and start returning the body to normal homeostasis. This gives you a little idea about how to use the ACE IFT model to design the high intensity interval training workouts. That presentation, combined with the information in the ACE certified article, should give you a much better idea about how to apply the ACE integrated fitness training model to design the high intensity interval training workouts that will produce results for your clients and group workout participants.